if you have, in my clinical experience in here, if you have had pain that nobody can figure out for years, or that kind of thing, tried all these different people, it is usually something that doesn't show up on x-rays and MRI. The adductor group, it goes like this and does the same thing I was trying to do with my hand and further gaps it open. He squeezes the ball, bends forward, no pain. SI. Mechanical issues I see all day long in here because they don't show up on x-rays and MRIs generally, right? You have to see the mechanics. What I do is I get the person out of pain and then demonstrate how I did it and show them what I need to do to make it stay. Or if you want to open and run one of these cash-based businesses that I have, charging $400 for 30 minutes, where you actually get paid and have people thank you for your clinical skills. Yo, everybody, what's up? It is your friendly neighborhood physical therapist. I'm in the light here. Dr. Ryan Whelton, coming to you live from just outside the cooling down Tampa Bay area. All that humidity is starting to wear off, my favorite time of year. If you are new to follow me, I am a physical therapist from the Tampa Bay area. I have a chronic pain clinic. I call it the I've failed everything clinic. So all day, 3 today. I've tried this, I've tried that. Nobody knows what's wrong with me. I get exceptional results in that patient population. It's not something I really worry about too much, getting these patients diagnosed accurately and better. I have an extraordinarily high success rate in this patient population. So what I'm doing today is I am talking about a case that I saw this morning of a patient that I evaluated and what I saw differently. Now, if you are new to following me, most people know me as a clinical expert. I publish statistically historic papers in the field of orthopedics and medicine, multiple times the readership, 3 to 5 years after publication of my medical papers, than even the biggest journals in the world. Like, literally went viral, off the charts in the considered medical history. They are pinned to my social media channels of the actual readership showing that. Now, what people don't know about me is that I have been starting to help people start and run these extraordinarily cash-based clinics based on clinical results, the way it should be. Patients want that. And I combine my clinical expertise and my business expertise of 17 years, basically doing cash-based business, and combined it into a cash-based clinic based on results, where you get $400 for 30 minutes. You get paid for your actual clinical skills, not some fancy sales technique, manipulating people into sign up with you that, whatever, like, if you want to use your insurance, you should go use your insurance. Like, I'm not your guy, but if generally you've, struggled to find answers, then that's where I shine, So I have been teaching people how to do that. And now I am teaching the rest of my colleagues how to do that. So if you click this link below, it says join my free school group. I am talking more about clinical insights like this, how to get patients better, and get how I get my patients better and how to get them out of pain immediately. And then I also am doing a clinical mentorship, but also a business mentorship. And you can do one or the other or both at the same time. It's pretty amazing. So, all right, today I had a patient come in. Now, this guy looked clinically depressed, and I don't blame him. You ready for it? Laminectomy in 2020 helped a little bit. Okay. After the laminectomy, he hurt his back again. Okay. He had numerous injections. Then he went to a chiropractor and no help. Then he had 3 fusion surgeries, and he reported that the fusions did not help. More injections after that, and SI joint injections, that did not help. Now, he sat right here, and when I listened to this story, I call it the I've failed everything story. When I listened to the story, I said, I think I know what's wrong with you. And he was actually caught off guard by that statement, because the reason why he was caught off guard is because he was like, come on, man, another guy, that says he knows what's wrong with you. But in my mind, I don't even care what you've tried here, okay? If you, in my clinical experience in here, if you have had pain that nobody can figure out for years, or that kind of thing, tried all these different people, it is usually something that doesn't show up on x-rays and MRIs, right? Because that's what we do. We look at pictures. And what doesn't show up on x-rays and MRIs generally is SI joint dysfunction, sacral torsion, sacral shear, which is shearing bone pain in the back. I published a paper on it that literally made medical history. 2 papers. And they get these shearing bone pain, okay, that, this thing's going dead. Shearing bone pain, hold on, like this, and he had an upslip on the left side, okay, bilateral out flares, okay, they usually always have bilateral out flares, I find, in my patients, bilateral out flares, and his tailbone was twisted like this, which can cause massive pain at the base of the spine called a sacral shear. Okay, so I said, his wife was sitting right here, and I said to his wife, watch this. I knew what was wrong before I even touched him. I said, watch this. And I put both of my thumbs on his PSIS, and I had him extend back. When he extended back, my left thumb translated superiorly, which told me he had an upslip of the pelvis. Okay, read my paper I wrote, or join my clinical mentorship. I go much more in depth into it. And upslip like that, okay? And so I laid him on the table, I pulled on his leg, and I brought him back down into alignment, okay? And then I first I always ask, have you ever had hip surgery? Don't ever pull on someone's leg, before asking that question. You pull on a total hip replacement, that person's going to the emergency room. So I pulled on his leg, I brought it back down. Well, excuse me, I laid him on his side, and then what I did is I went like this. I pressed medial on the ASIS, like that, okay? And when I got it medial, like that, he stood up, and his aggravating motion was flexion. He couldn't bend over, right? He would get to about here, he's, and when I got it, when I did that, laid him on his side on the mat and was pressing medial and gapping the ASIS like that, he was able to stand up. He was able to go farther, but it still hurt, right? So then what did I do? I put a kickball between his knees. Why? It's because when you fire the adductor group, it goes like this and does the same thing I was trying to do in my hand and further gaps it open. He squeezes the ball, bends forward, no pain. He's like, what? Like a ball is relieving my back pain. And so I'm like, let me show you, So I brought him over and showed him on this bone model. But he also had another issue that'd be shocked if he didn't have it. I find it goes hand in hand with SI joint is a sacral torsion. So if you read my sacral paper that made medical history and readership, if you read, these are all on my website, wheltonmethods.com. If you read my sacral paper, I streamlined that evaluation process in there. And I put both of my thumbs on the ILA, okay? And I had him bend forward. And when he did, my left thumb translated in anteriorly, which told me he had a sacral torsion, okay? From right piriformis weakness. You can follow it up with a 90-90 test, okay? Right piriformis weakness. And then what we do, so I rotated that back. So I laid him down and I pushed like that way, and I was rotating that back. After I got it back, I had him stand up, squeeze the ball, boom, no pain. He's like, you gotta be kidding me. And I'm like, okay, here's what was missed. I said, okay, great. You had an SI joint injection. I said, to me, that doesn't mean anything. That didn't work. The SI joint injection didn't relieve his pain. A lot of times they do, but I find like twice this week, actually. Another person said it didn't work, but then immediately I'm like, I think this is SI. Mechanical issues, I see all day long in here because they don't show up on x-rays and MRIs generally, right? You have to see the mechanics of it, right? So I showed this guy what was wrong with him since 2020, so 5 years of this. His back has so many scars on it from all the different surgeries, and he's probably depressed. But he was hopeful because he finally found someone that actually knew what was wrong, what was wrong with him type thing. And I was able to get him out of pain. Now, if you own a cash-based clinic, the way that they teach this stuff is you got to like basically manipulate the person, like get them to use pain points, like I'll let you play with your grandchildren. I don't do any of that. What I do is I get the person out of pain and then demonstrate how I did it and show them what I need to do to make it stay. You see what I'm saying? And these people trust me. The whole point of all those sales techniques is to try to gain trust, right? Relieve their pain and use your clinical skills. Be good at your job. Use your clinical skills. And if you don't have them, I will teach you how I do this, okay? That's why I created that free school group. Click below, join the school group, okay, for Rehab providers. And I am teaching clinical and business insights, okay, on I'm mentoring people clinically and business. But in there, I actually have a lot of videos. If you scroll down, here's how I get rid of tennis elbow pain immediately. Here's how I relieve headaches immediately. Here's how I diagnose SI joint dysfunction immediately and relieve their pain. Here's sacral dysfunctions. So I have all these techniques and stuff that I've figured out, how to help my patients with, and I've been teaching it for 10 years and it's all around the world. So that's that. That is what this poor guy has gone through, but I knew what was wrong with him before I touched him. And it did not matter in my mind that the SI joint injection failed because I wrote this paper that made statistically medical history that the reason why that happened is because people are finding it extraordinarily useful, like me. I hear from people from Nigeria, from Poland, from Bulgaria, from India, from Pakistan, everywhere that are like, dude, my patients can sleep through the night now. Like, it's crazy, So makes me extraordinarily happy to those people that are using it, okay? If you want to take your clinical game to the next level, okay, join my free group, okay? Or if you want to open and run one of these cash-based businesses that I have charging $400 for 30 minutes, where you actually get paid and have people thank you for your clinical skills, versus, all these cash-based businesses that people I hear from that are just kind of waffling around, I made $10,000 last month and, that kind of stuff. No, man, that's not, this week I've signed up 4 people at $4,000 plus other things. So like in a week, last week it was like 6 people at $4,000, but I also have the clinical skills to show them that I know what I'm doing. You know what I'm saying? So anyways, if you're interested in that, join my group, okay? The link should be right below. Join my free school group. If it's not there, go to wheltonmethods.com. And when you go to wheltonmethods.com, click courses and become a VIP member, okay? And that'll take you right there. All right? I'm going to go. Peace. Love you all.